Thank you so much for the warm welcome. And yes, I'm Caroline Green. My background is in social care and human rights. And since the 1st of September, I'm a proud member of the Institute for Ethics in AI. And so today I'm going to be speaking to you about the very beginning of a project I'm working on. It's part of a bigger project, which I will also share with you a little bit about. And so the title of my talk is Using LLM-based chatbots to Support Unpaid Carers of People Living with Dementia at Home. And I'll give you a human rights perspective on this. Before I start though, so what I mean by LLM-based chatbots, I basically mean ChatGPT and Pi AI as well. Can I just see, I see you all nodding. Who has actually played around with one of those? Okay, yeah, so you all know what they are. Just checking here. But yeah, so I'll give you a few definitions before I get into it. Here we go. Okay, yeah, so before I go into the essence of my talk, I just want to get everybody up to speed to what I mean by what. Social care, often I get asked, what is social care? What's the difference between health and social care? So healthcare is about, the health of a person, whether it is diagnosing someone, treating someone for a health condition, where social care is a very broad term that refers to very generally support of an individual to help them with the activities of daily living. And that may be also social work, it may be mental health support and so on. So it's a very, very broad term. What I'm referring to here in this talk is the support of older people who need care and support because, for example, they have got a cognitive impairment, such as dementia, or because they're frail and comorbid or so on. What do I mean by an unpaid carer? An unpaid carer here is somebody, maybe a family member, a friend, a neighbor, so who gives help and support to anyone because they have a long-term physical, mental health condition or any kind of problems related to older age. And of course, dementia is a general term for several diseases that affect memory. That may be Alzheimer's disease, but we know it's a huge issue for our population here in the UK, with around 1 million people living with dementia alone here in this country. But we also know there's probably many more people affected. And globally, it's the 7th leading cause of death and one of the major causes of disability and dependency among older people. And this is set to rise with demographic aging that we're seeing around the world as well. So let's stay in the UK though. How many unpaid carers are there? We don't actually know. So from our census in 2021, they said we're around 4.7 million carers, so family carers, that's around 10% of the population. But other organizations, charities have said we've got up to 11 million people who are carers and 8,000 becoming carers every week. Yeah. The economic value of what these people are doing, namely caring for some of the most vulnerable people in this country, equates to £162 billion per year. That's basically the whole budget of the National Health Service. So they are doing a really incredible, really important job, and it's often very difficult, very stressful. We've got a lot of research into the support needs of unpaid carers in this country. Just also to very, very briefly touch on professional care sector. It's hugely under pressure in this country. We have 165,000 people missing professional carers that we actually need. That's a vacancy rate of 11%. And also our workforce, they are incredibly skilled, of course, because what they're doing is really important. But 53% do not have any professional qualification in their care. So that's just some of the definitions and statistics, so you get a bit of a picture of care in this country. What I now want to go into is something that I call the fundamental values of caring. So here in the UK and also some other countries, but especially here, we've put a lot of thought into the question of what does it mean to care well. We really want to define that. And when you look at all the documents, thinkers that have led that conversation, human rights is really the framework, the fundamental foundation of this question, of the fundamental values of caring. Human rights are the rights and freedoms we all have simply for being human. It's something that applies to all of us. They are enshrined in documents like the Universal Declaration of Human Rights, and include the right to privacy, and you all know the right to be free from inhumane, degrading treatment, the right to social participation, and right to health, so on. A huge list of human rights and freedoms that are so important here for us to know what good care means. But then there are also other values and principles even that are very much part of our culture of care. So person-centered care is really important. It means that we put the care of a person, we put the person in the center of it. We want to know who this person is, what their experiences have been, what their preferences are. And so we want to look at this person holistically and give them care in accordance with what they want and what they need. And then also really important for us is that there are effective outcomes of care. So we want the care to be protective of someone's dignity. We want to maintain autonomy and independence as much as possible, to allow also people who may have dementia already or be living with Alzheimer's to whatever extent it is, to still make sure that they've got capacity to make certain decisions and really maintain this being a person making choices, but also well-being and safety. And then there are other values like kindness and compassion and so on that are maybe sometimes a bit more difficult to enshrine. Can we have a right to be loved? And I'm not going to go into any details, but these are sort of our fundamental values of caring in this country. And here I've said limitations UK-based. So what I'm going to go into, I think the massive limitation is that we're talking about these values that we've got here in the UK. And I know we've also got them in Europe. You know, when we talk about care, what does good care look like? But in other contexts, in some African countries or wherever we go, those may be very different cultural considerations that are not part of this talk, but they have to be. So where are these fundamental values of caring written down and enshrined in this country? Here we've got a huge amount of laws and regulations. For example, the Care Act, the Mental Capacity Act, which is a very interesting piece of legislation that protects the autonomy and the decision-making power of people living with any kind of cognitive impairment. So we'll make sure that someone can make choices and even make unwise decisions in situations of where their capacity or their cognitive impairment may limit them. And who is entitled, I've called them here entitled rights holders, under that fundamental value of care. That's of course the person in need of care and receiving the care, but also the carers. So here we believe, and quite rightly so, that we live in relationships with people. And when it comes to unpaid carers, we also have to make sure that whatever support they're being given, whether through the government or so, is also person-centered to whatever experience they're going through. And then who's responsible to act on all of this? Of course, state actors and government under international human rights law. It's governments and state actors that are the main duty bearers. But then here, what these laws and regulations have done is that also private care providers, like private care homes, over 90% of care homes in this country are private providers. Hospitals and their staff are responsible under human rights, under these values of care, to protect them, to make them a reality. Local support services, that may be charities who are supporting people living with dementia and their carers. That's a little bit less clear cut, depending on what kind of support they give. With tech platforms, whatever kind of technology we have, again, that's not quite as clear. So the Care Quality Commission, which regulates care, health and social care services in this country, they have said, they regulate digital healthcare platforms, but with social care, it's not quite as clear as that. And then, of course, carers at home, we've got that public privacy divide. What people are doing at home is their family business. Okay, so that's a bit of the landscape and those values that we've got in this country, and a really, quite a big broad catalogue of laws. And this is just an example of the Care Quality Commission, where I wanted to show you sort of proof from what I'm saying. You can also see that in our laws and regulations. Care Quality Commission, which says here, we need a human rights approach because, you know, we need to respect the diversity and so on. So I think that's a very, very powerful statement of the importance of human rights for caring in this country. So what I'm now going into is this project that I earlier told you I'm working on. It's funded by the UKRI, started a year ago. And what I'm doing in that project is that I am actually trying to build with colleagues a AI-powered platform in the form of a website and an app that will support family carers with their everyday care tasks by giving them solutions, advice, and whatever they may need in a moment of need or in a moment where they want to educate themselves. So what we need to do here is, of course, we've got the technology that we need to build, and we're working with software developers. But what we also need is to find a really high quality content base that we can feed our software that in order to be able to provide them with this advice and guidance. And what I found, so what we're doing is we're talking to a lot of different people, a lot of different organizations that provide content, you know, they help carers and so on, and then talk to care professionals. And what I found here is that a lot of people say to me, well, why don't you just use ChatGPT? And you could just, you know, take the answers and moderate them a little bit, and, you know, make that your own content. Or you could maybe also just have someone sit there and see if someone asks her. So they've got all sorts of different ideas of how we could just use ChatGPT off the shelf as it comes. And some professional carers and some family carers have also told me that they have tried it before, that when they've had a question, they just put it into ChatGPT. So I do not know how often and how big of a scale that is. Yeah, how many people, organizations are using ChatGPT just like this and, you know, asking care questions, but something is happening. So what I want to understand right now is how to ChatGPT on Pi AI, which maybe you have come across by infliction. It's a personal assistant as well that like really communicates with you. I wanted to know, how do ChatGPT and Pi AI generated responses to care related questions map onto our fundamental values of caring? So what I've done is I've actually fed, and please don't try and read all of this. Yeah, I just put it on here because I wanted you to see that you get quite big answers to questions, pose it to ChatGPT. I've given it some questions that I found in a forum where carers had asked questions. And I asked it, "Hi, my father's frail and wants to go outside for a walk by himself. Should I let him?" The response that I got was, here I'm just the highlighted bit I found really interesting. "Oh, I'm not a medical professional, but I can provide some general guidance. Ultimately, the decision to allow your father to go out for a walk by himself depends on his health condition, mobility, and any specific concerns or risks that may be present." And then it gives a whole list of what the considerations are that you should be looking at, for example, so to make an informed decision, you as the carer. So, familiarity with the area, regular check-ins, and so on. Here, point 6, I found interesting: discuss concerns openly, have an open and honest conversation with your father about your concerns regarding his walk. I mean, that depends where, if it's a person living with dementia, on how far you can talk to them. And in the end, it says, ultimately, the decision should prioritize your father's safety and well-being. And if there's serious concerns about his ability to walk safely alone, it might be better to explore alternative options. All right, I'm just going to leave that here. The next one was, my parent with dementia wants to drink alcohol. Should I let them? Yeah, it starts with allowing a person with dementia to consume alcohol can be very complex and sensitive. Again, it gives a whole list of considerations to help guide your decision. Yeah, and again, it looks, monitor alcohol consumption, educate and communicate. Here in point 7, it says respect autonomy and dignity. So whenever possible, respect your parents' autonomy and dignity by involving them in decisions about their own care, including those related to alcohol consumption. So remember, the primary concern is your parents' safety and well-being. It's essential to make decisions based on their best interest and consult healthcare professionals to ensure their health and safety are prioritized. I then spoke to Pi AI as well, and I asked, oh, I have a mother with dementia, I cannot care for her anymore, I want her to move to a care home, but feel guilty, what should I do? And then it involved me in this whole long kind of conversation around, oh, that sounds quite empathetic, oh, that's a tough situation, I understand why you're feeling that way. Now, at the end of it, I still didn't know whether I should move into a care home or not. But anyway, you know, it asked me a lot of questions about myself. So I spoke to Natasha Davies, who's a senior wayfinder. She's a care professional working in an amazing support organization called Sage House Dementia Care, cares for people, carers and people living with dementia. And I wanted to hear from her what she thought about these answers. Yeah. And she said, well, you know, actually quite positively, it does seem to reflect some of the fundamental values of caring, you know, like safety and well-being, dignity and autonomy. And of course, we've now got 24/7 support, which people usually don't have. I mean, at 2 o'clock in the morning, you can ask and you get something really quickly. So information is easily and quickly accessible, quite like that. Could take some pressure off. But then there were various areas of concerns. So first of all, in terms of the value-based concerns, apart from it being, you know, quite, you can see, you know, trained by our English-speaking data, can see these fundamental values of caring. Can we translate them into other contexts? There's a lack of person-centeredness due to generic answers. So she said the experiences of people living with dementia are unique, and what might work for one person may not work for another. So of course we had, you know, it's like you should make the decision rather than looking at that person and trying to engage with them. Also with the Human Rights and Practice Act, I don't have much time, so I'm going to jump over that. Another area of concern were of the legal concern. So the principles of the Mental Capacity Act, which only applies in England and Wales, but Natasha pointed out, is that you always have to see how a person is in that moment, and then you can help them make a decision or not. Yeah, and of course, with a ChatGPT generic answer, you're not being told to do that in that way. So are we then breaching a piece of law if you follow that advice blindly? But then we could say, you know, it did also talk about autonomy and dignity and so on. So again, there's something we could talk about here. And then there are lots of concerns. I only put one here around the effectiveness. So sometimes, or well, not sometimes, actually a lot, we know that carers are facing something called a carer breakdown. They just don't know what to do anymore in a situation. And they might actually just act on whatever ChatGPT has given them in this moment because they're so stressed and because actually the answers look pretty good. But then we know this is just a machine. It doesn't have values and it will just spit something out. And at times it might also spit something out that really is not in line of our fundamental values of caring. And again, we also just saw that the person-centeredness is not there and so on. So there are lots of concerns. So some of the questions that I ask myself, and of course there are kind of bigger questions, should we be using it at all in that kind of context? Is it fit for purpose at all? How is it going to change our relationships of caring? But more acutely, I'm asking the question, how can we educate carers about using generative chatbots to support care safely and effectively? We could ask that question also about generally the internet, right? But I think, you know, acutely now knowing that people might be using this, we should think about it. And how can we ensure that care services deploy this kind of AI in a safe and transparent way? So if people tell me, oh, they're using that now, I'm building my chatbot, how is that kind of plan out? And how can we help them to make sure that this is safe? And then I'm also wondering, are our human rights-based legal regulatory frameworks and these fundamental values of caring, are they still adequate in today's context? Do we need to rethink them and therefore involve all the different organizations and people that are involved in them? That brings me to the end. Thank you very much for listening.
Thank you very much. This was fascinating. So we've got about 10, just under 10 minutes for questions, comments. Yeah, Claire.
I was just thinking, you know, you mentioned that the internet generally, and presumably care homes have been using that for years. Do you have similar concerns about the fundamental ethics of care being embedded in the internet? Sort of, if you did a Google search, do you think that'd be more reliable and more in line with what you're looking for? Or is it just that chatbots taking everything from the internet? It's rubbish anyway.
So, I mean, the difference is with the internet is that people can actually see where it's coming from. And even though we do know that there's a problem that the information landscape is fragmented, there's a lot out there, and some of the organizations, we don't actually know how good the quality of information is. Still, people can and do make a judgment of whether they trust the source or not. And here with ChatGPT, they might just, they don't know where it's coming from, right? But they might be trusting it because it sounds so good. And it sounds so reasonable and aligned with their values. So that concerns me a bit because at least you can check. Otherwise, in the NHS, okay, I'm going to trust that.
Yeah.
Yeah, thanks. It sounds like a really interesting research project. And I guess my question is one of those questions that you asked at the end, which is, can these tools, the current generation of tools, ever be used safely, given the fact that they can generate potentially incorrect outputs, or the model can shift over time, so it might give different answers on different occasions. Where do you go if the answer is no? Is it just a case that these models can't be used at all? And is the idea, it sounds like the idea is to train a better model that is going to be more effective. And can that be built on top of one of these models, or do you have to start from scratch?
So the first question, I think that we can't stop it. I think that now it's out there and people are going to use it. So I think that's why I feel that maybe the answer is to talk about it and to educate people in that situation. Be careful what you do. So that, and then the second question, yes. So what we're trying to do is that you can take the model, so the large language model, and then train it with your own content in a way that it then also tells people where did it come from, how, what's the content put together, and it will show them the organizations that have provided the content. So that's how we're trying to, get that trustworthiness, that transparency and fact built into it. But it's not an easy thing to do.
Yeah, it's really interesting, and it just felt sort of very culturally specific. If you're into pop psychology and so on, it's, as you said, there's the affirmation, and then there is the considering different options, and then but ultimately the decision is yours along with the principle of your parents' safety. And I was just thinking, because I work as a China studies person, and so I could just imagine very different texts, something like, as we all know, the family is the basic cell of society, and we have a responsibility as sons and daughters to treat our parents filially. And so I'm just wondering, is there anything is there anything cross-cultural on this? Because it does seem to be a kind of sifting of template forms of guidance. In the Chinese context, you may even have things like, sort of state endorsed, like about self-reliance, self-dignity, self-love. There's the 4 selves, and so in that case, if the advice is so culturally embedded, what is correct advice?
So I think that's a really interesting question. I think that human rights, the role of human rights here is really important, because human rights, the beauty about it is that it's an international moral framework of values that are supposed to apply to us all. Now, of course, some people might say, well, from some cultural perspectives, that's not quite true, yeah. But in principle, that is something that that could give us an international moral perspective. But in the end, I think it's something incredibly difficult to pull off, to build something that is globally applicable. And I personally don't think it's possible, because we all are different and cultures are different. So, but yeah, maybe people have different thoughts on that.
Yeah. I think we probably have a lot of thoughts.
Yeah.
Well, we've got about 2 minutes.
I was just interested, is there some research about what actually carers want and where they want to look for the answers? Because I was just like thinking that if I had been a carer, I might like just look at NHS website,
Yeah.
which has lots of accessible information.
Yeah. I mean, there's quite a bit of research that, first of all, we know that in this country, people generally feel unsupported when it comes in on all sorts of ways, but also with information and advice and guidance, they also feel unsupported. And then it's not one group where we can say everyone is the same. So, there's some people who will go and use the internet quite a bit. There are others who want to talk to health professionals. What we do know is that people generally still like the human contact, and they're seeking the human contact. And ideally, they'd have that trusted person next door they could ask these questions to, and they can talk to about it. So that's most generally what people want. But they feel very unsupported here, and need more in terms of advice and guidance and information.
We've got 1 minute left. So, quick question. Vicky?
Maybe it's just a quick question. I was thinking actually about the ethics of carers using these sorts of services in the first place and potentially giving up their sensitive information about who they care for. I wonder, how you would consider that with the constraints of the project.
Oh yeah, absolutely. I mean, absolutely. And we're, working with lawyers and in all sorts of ways. So I think that's incredibly important. I mean, often, of course, developers also say having people's data is, what's going to help us with this business and, to know more what people need and so on. I think that's also an ethical consideration of, is there a way that we could then also work with that data to improve lives? But yeah, to answer your question, it's a very big consideration.
Thank you very much.